So let's talk about a full facelift. So the variations of these procedures can get kind of confusing. So there's mini facelifts, there's full facelifts, and there's face and neck lifts. So this is talking about a full facelift. What a full facelift does is treats the jowls by elevating the cheeks back up where they are supposed to be. This is done through an incision in front of and behind your ear. The incision in front of and behind your ear goes up along your hairline a little bit, about level with your eyebrow. And through that incision, the skin is lifted up. And then I access the SMAS layer of your face, which is the deeper, stronger layer of your face. And I use that layer to do all the heavy lifting. That layer is then elevated up to your cheekbone level up here and sutured to really strong tissue up there. And it is that tissue, the SMAS layer, that lifts your cheek and jowls up, treating your jowls and giving your cheek volume back where your cheek is supposed to have volume. The reason I like to use the SMAS layer when I do a facelift is it creates a longer lasting result and it creates a more natural looking result. If I relied on your skin to do all the lifting, people can look like they're in a wind tunnel. They have that pulled, wind-blown look. And that's because when the skin is pulled tight, it makes the cheek go flat. What we want to do is elevate the cheek tissue with deeper, stronger tissue so the skin can cover it like a normal covering that skin is. That's what skin does. Skin is supposed to cover the tissue, not lift or suspend the tissue. So that's how a facelift is done. Incision in front of and behind the ear, skin lifted up, SMAS layer elevated and dissected free, and it's that deep layer that does all the work, and then the skin is draped over the top of it, the extra skin is cut out, and the incisions are closed up with suture. Now I do put a drain in place. If you're having a full face and neck lift, it is one drain that goes from one side behind your ear to the other. If you're having only a facelift, I will put in two drains because sometimes the two sides are not connected. So in summary, facelift or full facelift is performed to lift the cheeks, which treats the jowls, and the SMAS layer is the deep layer of tissue that does most of the heavy lifting. If you want to learn more about other types of facelift as well as neck lifts, check out my other videos. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.